We're talking about diabetic retinopathy. That's a problem that happens with the eyes in people with diabetes. And we've got about 40 million people with diabetes in the United States. And about 10 million people, so 30% of people actually have this eye problem, this diabetic retinopathy. And what it is, the retina is a part of the eye. It's a thin piece of tissue that's located in the back of the eye. And what it does is it helps sense light and sense images, and then it sends that information to the brain. And that's how you're kind of able to see. So when blood sugars remain high for a really long time, so uncontrolled, that's when problems happen with the small blood vessels that go to the retina and cause retinal disease or retinopathy. And incidentally, out of the about 10 million people in the United States, so 30% of people that have this, it's more common in males, and then it's more common in African Americans, and that would be non-Hispanic blacks. It tends to be more common, but it can happen to anybody. One of the problems with diabetic retinopathy is that it can lead to vision loss, and it's one of the most common causes of blindness too. And so that's problematic. That's why it needs to be kind of paid attention to. And so what are some signs and symptoms of diabetic retinopathy actually? So initially, when it's really in its early stages, you're not going to have any signs or symptoms, which is why getting an eye exam is important. And we're going to talk about that a little bit later. Initially, you're not really going to have any symptoms. And in its early stages, that's when the treatments tend to work really well. But you can get blurry vision, but blurry vision can be a symptom of other things too. But blurry vision, there's dark spots or floating spots that you can get on your eye. You can also have problems seeing things that are in the center of your eye. So if you can just imagine, like if you're looking at something, you're not going to be able to see kind of like what's in the middle. You're only going to be able to see what's on the edges of your eye. And then just trouble telling colors apart. Those are all some signs and symptoms of the diabetic retinopathy. And so there's different stages of it. When it's in its earlier stages, it's called non-proliferative diabetic retinopathy. And when it's really severe, then it's proliferative diabetic retinopathy. And so the non-proliferative has about 4 stages. And the first stage, which is really mild, you might have some swelling in the blood vessels in the retina, and they start to leak a little bit. In stage 2, it's a little bit worse, and there's some more leakage. And then there's going to be some blockages that start to develop in the blood vessels. Stage 3, there's more blockages, and now blood flow is being cut off. And then, as you can imagine, stage 4 is even more severe. There's more blockages. And then when you get to proliferative diabetic retinopathy, at this point, there's so many blockages that now there's new blood vessels being formed and going to the retina, which actually is not a good thing. And like I said, it's the most common cause of blindness in adults ages 15 to 64 years old, and it can be avoidable. So the most important thing for people with type 2 diabetes is to get an annual eye exam. And for type 2 diabetics, once you're diagnosed, that's when you have to start getting this eye exam. It's really important, like I said, if we can catch it early on and start doing treatments for it, then you don't progress to the point where now you're getting blockages in the vessels and having problems. There are treatments for it too, but you want to avoid getting to the point where things are really severe. So you want to catch it early and start getting treated early, and outcomes are much better. And type 1 diabetics are at risk for this too. And in their case, they start getting screened about 3 years into having the diabetes. But type 2 screening starts right away, and it's every year. So for life, once you're a type 2 diabetic, even if you're reversed, so you're off of medications and you're just controlled with diet and exercise, still need to get this eye exam every year. for the rest of your life, because you really want to keep an eye on this. And this is just only one of the eye problems that potentially can happen with diabetes. What are the screening tests that are used for diabetic retinopathy? There's two main ones. So this one you might have already had if you're up to date on your eye exams. It's the dilated eye exam, and optometrists, ophthalmologists, they do these for other things too, but looking at diseases in the retina, this is one of the things that it's done for. So you're given like these dilating eye drops that kind of dilate your pupils, and they're able to see to the back of the eye and get some good views of the retina to see if there's any signs of problems with the blood vessels, any signs of disease. And then the second kind is digital retinal imaging. So in that case, you don't have to get dilated. They're using a special camera to take pictures of your eyes and take pictures of the blood vessels, and then it's going to be examined to see and make sure that the blood vessels in the retina don't have any signs of damage or retinopathy. And if it does, then you're monitored more frequently just to keep an eye on that and make sure it's not progressing. And how often you're monitored depends on the level of severity of disease. The main thing is keeping blood sugars under good control. That helps to prevent damage to the blood vessels. And so just remember that eye health is really important. Type 2 diabetes, need to get your eye exam yearly.